So I'm minding my own business and I receive a call from my mother in law who is distressed about one of her cows. And she goes, "It seems like something ain't right. It can't stand up." So this is where I put on my medical cowboy hat and go out and look at this poor animal. And as one can see, it clearly can't stand. Not only can it not stand, its hind legs are splayed open. And I walk around, I look at the animal's very anxious. Number one, probably thinks I'm a predator trying to kill it. But number two, wants to be able to stand but can't. And as I start looking around, I realize this heifer has, which is now a cow, has just given birth, and yet the vultures have come and taken care of the calf, pecked out the eyes, pecked out the rectum, and kind of tore the carcass apart. So we pull all that over the side because they will start attacking the cow, particularly since it's down like this. And as I go to examine it, it becomes pretty clear to me that the back legs are in fact paralyzed, which is analogous to what I do for a living. And what had happened is this heifer, an animal that's never had a cow, attempted to pass a fairly large head through the birth canal and split her pelvis open, paralyzing her because it injured the nerves going down the legs. And these are the sciatic nerves, the nerves that I work on a daily basis. And it took a while to figure out the diagnosis, but ultimately what happened is I put a harness on her pelvis, lifted her up with a tractor, and let her legs dangle. And over a period of a couple of days, the hips recovered, but the feet never did. And so she's walking either on her knees or on her ankles. And I really thought that was kind of curious because, again, much of what I see in clinic are patients who have injured their sciatic nerve, either from a disc rupturing out, as they sometimes do. And again, this model shows in red the disc joint that moves between the two white bones, had ruptured out and was hitting against the nerves coming off the spinal cord. And that can cause patients to have paralysis, but more commonly, it causes them to have a drop foot or a slap foot. So when they're walking, the foot slaps the ground or drags or catches, and that's probably the most common reason people trip. So exact same thing happened to this poor cow, except for different reasons. It wasn't a disc problem. It was because the pelvis split itself open, stretching the nerves, then leading to paralysis. So this has now gone on for 2 weeks, amazingly enough. And this animal has been able to feed for itself and drink water, and we keep the vultures away. But hopefully this weekend I'll see her starting to walk, but it's a very slow recovery, which again is very similar to humans. When nerves get stretched or injured by disc ruptures, it takes up to a year to recover. Hopefully it won't take that long for this cow, but I'll keep you posted. So as I'm thinking over the last 30 years of my career, I've seen many, many cases of paralysis, most of the time coming from car accidents. And again, the vast majority of those are from people who are not wearing their seatbelts and are ejected out of a vehicle when there's a collision or even a rollover, because as a car is rolling over, the windows break out. And so people just sometimes kind of fall out of the vehicle and then the car rolls over them after they've been ejected. So I've seen lots of cases of paralysis. Probably some of the more difficult ones are the 17-year-old football players, because they break their necks and they get quadriplegia, and there's just nothing that can be done for that. The lower back ones, it's amazing how much society has adapted to wheelchairs and to accommodate people with weakness in their legs and disabilities. Probably the most notable one was expanding all the doorways now from 32 inches to 36 inches, so it'll accept a standard wheelchair. The other thing that's really been very helpful are self-driving vehicles. So people who don't have control of their legs can use a self-driving vehicle to navigate where they need to go. Another accommodation is also the ability to put hand controls on a steering wheel that will allow an individual to control the accelerator and the brake by using their hands. And so that's really made a big difference, along with the specialized bathrooms. Those have now become standard. So people who had weak legs or paralyzed legs are no longer homebound and can have more productive lives and be out in society more. And it's turned out to be a big money saver for the federal government, because most people with paralysis end up on federal government insurance. But if you keep them mobile, you can keep them working and keep them part of life. But the more common forms of paralysis are not complete paralysis. They're the partial paralysis, like we talked about with the foot slap. When people are walking, their foot slaps or trips. And that has also been helped by the improvement in metallurgy as well as plastic materials. So now we can make plastic inserts for the shoe or the foot that will keep the foot up when you walk. You put springs in them, and people then can walk without that type of disability. I saw a happy case today. I'd not seen this gentleman in about a year, which is a good sign. But he works in the sanitation department, drives a big truck, is active around town, and unfortunately developed a very malignant bone cancer. And this is a man in his 50s, and that cancer was located right about here. And by the time I saw him, the cancer had eaten through his spine and was starting to attack his spinal cord. And that's when his legs were going weak, and along with that, losing control of his bowel and bladder. And so that's when he first came to see me. And the diagnosis was just overwhelming for him. And obviously, he didn't know he had it. He walks in my office, says, "My legs are weak." And I take just a single x-ray because it was so obvious. I said, "You got a bad something going on. It looks like a malignant cancer." And he didn't like that and left. And over the period, approximately the next 10 days, he went paralyzed. And at that point, he was willing to listen. And we did all the appropriate medical tests to determine what type of cancer it was. And it's always stuck in my mind just because it was such a malignant cancer, and you just don't see it in that age group. And then also, he really didn't want this diagnosis. So like many of us, he want to run away from the problem, but it obviously caught up with him. So went in surgically, had to go in through the side, through the belly, as well as his back, and have an artificial section of his spine manufactured to support his body weight. Because what I did, in layman's terms, went in and cut out the cancer without damaging the spinal cord, and then put a replacement bone in there made of titanium. So basically, I took out this whole section of the spine, put column support in there with a metal plate on it, and then additional rods and screws, and he lived. And not only did he live, he's gone back to work, and now has shown up for a follow-up today, about a year and a half after his surgery, and doing pretty well. Still has a little bit of a neurologic problem, but that's the kind of case we like to see. And it looks like he's beating his cancer, although he's still receiving monthly chemotherapy treatments. But he's adapted to it well, and he's at peace with it, and he's grateful for it. And he and I both shed a tear today. You're watching C-Spine Show. I'm Dr. Craig Callowart, an orthopedic spinal surgeon in Dallas, Texas. Please like and subscribe.